All right, thank you, Chrissy. Well, we're going to talk about the latest in corneal implants today and why that is such exciting news for so many people. Dr. Charles Flowers is here from the Flowers and Suter Vision Institute this morning to kind of get us up to speed here. Who is affected by these latest developments here?
Well, actually, these implants have been around for a little while. They've been around for at least over 10 years or so. They were initially developed for treating myopia. They were initially introduced into the eye care marketplace to compete with LASIK, but it was found that it wasn't nearly as effective for myopia as LASIK was.
However, so LASIK is very, very simple, laser surgery,
right,
and making little cuts in the cornea to reshape it.
Yeah, exactly. Okay. These implants subsequently fell out of favor. However, we discovered that they were very effective for a condition called keratoconus, which is a degenerative condition that causes your cornea, which is the major lens of the eye, to begin to thin and distort.
So the keratoconus is something that affects how many people?
Usually the incidence right now is anywhere from 1 out of 10,000 to 1 out of 15,000. So it's not that common of a disease. However, being an eye care professional, I see more of it.
You see it all the time,
exactly.
Certainly, being a professional. So what's involved here then? You'd say the cornea starts getting thinner, so it loses its capability to focus. It loses its lens capability.
Absolutely. And what happens is, in a lot of these patients, that it gets so thin to the point where we actually have to do transplants in these patients. However, with the introduction of these new implants, we can now implant these
an artificial device.
Artificial device in the corneas to help stabilize them, so these patients don't have to go on to a very invasive procedures, a transplant.
Okay, we've got some interesting pictures up here. So what actually happens? How does this work?
Well, generally what happens is that what you're seeing now is just, that's an illustration of how we go about doing a corneal transplant in these patients who have keratoconus. But generally what we do is we take two semicircular segments, if you will, insert those into the cornea, and they provide extra tissue support so the cornea doesn't progressively thin and distort.
And about how long does a procedure like that take?
It takes me about 20 minutes to do a procedure like that. And once the implant's in, they are inert. They're biologically inert, so the body doesn't reject them.
They don't deteriorate over time?
They don't deteriorate over time. They can stand for the rest of their life. And in fact, most of these patients become contact lens and glasses intolerant, so they can't even see with contact lenses and glasses. However, after we do the implants, they become glasses and contact lens tolerant, where they can go back into their contacts, wear glasses, and see very nicely without having to go on to have a transplant.
So for the folks that are affected by keratoconus, this is huge.
Absolutely.
Huge news.
Absolutely.
Great stuff. All right, if folks have any more questions, Flowers and Suter Vision Institute, that's the place to go, people to call, right?
Right on.
Okay.
Right.
Dr. Flowers, always great to see you.
You too, big guy.
Thank you. And when I say see you, I mean it's great to see you. All right, Congress is swinging a big bat as it looks into steroids in baseball. We'll tell you why lots of major leaguers will be glued to the news on Capitol Hill today. And lots of celebrity must-have items are coming right here to San Diego this week. We're getting the first look at the hottest spring purses, jewelry, and lingerie. Next.